today we're going to talk about hearing loss. Hearing loss is really grouped into two categories: problems that come from the eardrum or the middle ear. They're mechanical problems, and we call them conductive hearing loss. And then there's the more typical thing where the nerve ages or the nerve becomes degenerated from toxic problems or excessive noise exposure, which we're actually seeing more in kids. Those nerve type losses are called sensory neural hearing loss. Anytime a patient comes in with a complaint of hearing loss or a suspected hearing loss, or a child is brought in because he's not paying attention in school or he has speech delay, we get a hearing test. The hearing test is really the basic assessment, and it's very objective. A hearing test is very accurate. It stands up to repeating. You'll get the same results if you do it over and over. And it really tells us the type of the loss and the severity of the loss. And so it's the first stop on the train in terms of making a diagnosis and selecting the proper treatment. There's conductive hearing losses that are caused by mechanical problems of the ear. The most common and sort of trivial example is just excessive earwax. And patients who have that type of loss will usually complain of blockage. Conductive hearing losses also occur in kids. The most common example in young children is serous otitis media. So they've had ear infections and then they still have fluid in the ear. The infection's been treated, they don't have any pain, they don't have any fever. All they have is hearing loss, and if they're small, they don't complain about a problem. They just sort of wander off and get distracted and don't pay attention to the teacher in school, behave badly. So in those cases in particular, it's important to suspect the problem and to get the exam and the hearing test before too long, because these are very, very easy problems to treat. I think that people who have hearing loss, and especially if it develops gradually, often don't realize that they have a problem, and they just become withdrawn from social interactions. And this is particularly true in elderly people. Some older people will have progressive loss of hearing, and maybe they've tried a hearing aid of the old technology and it wasn't suitable, so they put it in the drawer, or maybe they were just stubborn and resistant and they never wanted to get a hearing aid in the first place. And they respond to that by becoming withdrawn. You're trying to engage in a conversation with people, maybe it's a noisy environment like a restaurant, and you can't get the drift of the conversation, and so you just drop out. And a lot of older people, and this has been well substantiated from some of the current research from Johns Hopkins and other places, a lot of older people are labeled as demented or severely depressed when all they have is a hearing loss. And if you can get to those people and treat them with a proper fitting hearing aid, or even a cochlear implant if that's what they need, they'll become active members of society once again, and active members of their family. For patients with conductive hearing loss, the cause may be something simple that can be treated in the office. In adult patients with fluid in the ears, we can drain fluid in the office. That's a simple procedure that we can do with a local anesthetic. There are more complicated problems, though, that arise. Chronic ear infections is one. If somebody has a perforated eardrum and you close the perforation, or if they have destruction of the little hearing bones from infections, and you can repair that, you can restore the hearing, and that's usually a very gratifying thing. I want to mention a condition called otosclerosis. It runs in families. It's a genetic condition where the bone of the inner ear changes in quality, and those people have progressive loss. That's conductive. The eardrum works fine, but the sound doesn't get through because the little hearing bones don't conduct the sound. And when we identify those cases, we can do a small operation called stapedectomy. It's done in the hospital on an outpatient basis, where we lift the eardrum and separate the little bone that's fixed and replace it with an implant that's made out of plastic or wire. And in those patients, the hearing comes back 95% of the time. It's really quite gratifying for the patient as well as the surgeon.